Boo.
Mhm.
Okay, thank you for
Kelsey.
being here today. We are going to talk about a prevalent issue that has been rising in the United States. First off, I want you to imagine you're in a world where sounds are much, much louder and deeper than normal, and that your emotions are also as deep, and communication is very little or not at all. Um, let's see. For 1 in 36 children in the US, this is their daily experience with autism, and that's what we'll be talking about today. So, autism is autism spectrum disorder, or ASD. It is a developmental condition that affects how a person communicates, interacts, and experiences the world. It is called a spectrum because it varies widely in the diagnosis and from person to person. Kind of think of it like an umbrella. Autism is the top of it, and then underneath there's all these different branches within it. Diagnosis typically occurs in early childhood through developmental screenings and evaluations by specialists. We'll talk about those a little bit. So, the developmental screenings are usually done at regular pediatric checkups, especially at 18 months and 24 months of age. The doctor will ask questions and use a checklist if there's any concerns to assess speech, movement, and behavior milestones. Comprehensive diagnostic evaluations is also a big part in this. If any concerns do arise in the screening and from the parents, uh, they will do a more in-depth evaluation, which is done by a specialist, such as a developmental pediatrician, child psychologist, or psychiatrist that deals with pediatrics. So typically, when this is diagnosed, it's very, like I said, very early on. So we're dealing with pediatrics at that point being diagnosed. It may even be diagnosed by a pediatric neurologist as well. Some diagnostic um, tests that they can do is Autism Diagnostic Observation Schedule, or ADOS. One of the most widely used tools um, involves observing the child in their communication, social interactions, and play. This can be used both verbal and with nonverbal kids. Usually in early ages, verbal communication is very little at this point, if any, and it's delayed. So most of the time in early kids, it's nonverbal observations with them. Another diagnostic test that they can do is Autism Diagnostic Interview Revised, or ADI-R, a structured interview with the parent or caregiver that focuses on the child's developmental history and current behavior. So, again, a lot of this is more just observations. There's not just one specific imaging test or blood test or anything like that that can confirm the diagnosis. They can do genetic testing to see if there's any markers that could possibly contribute to autism in the parents. But there's no specific test that says your child's going to have autism. Another diagnostic that they can do is Childhood Autism Rating Scale, or CARS. It's a checklist completed by a professional based on, again, observations and parents' reports. It rates behaviors in areas, again, like communication, emotional responses, and body use. So, a lot of times in early kids, again, they can't communicate, so they will voice, in a sense, their feelings and communicate with their body. So sometimes they can get physical. That's because there's a need that they're wanting that is not being met. And that's the only way that they know how to communicate with you is by using their body. Common characteristics with kids with autism is kind of hard to diagnose across the board because it does vary with the diagnosis and the child. Some speak fluently, while others can use very few or no words at all. So any delays in speech, usually is a good indicator that there could be a possible diagnosis of autism. But it also doesn't confirm it because they can just be delayed in speech. Doesn't necessarily mean that they have autism. They may engage in repetitive behaviors and prefer and thrive on routines, or have intense interests in specific topics, such as iPads or toys. They will be fixated on this and want to play with it constantly. They also have sensory sensitivities. That's pretty common. Loud sounds can be a trigger, bright lights, certain textures, like how your shirt feels, can also affect these kids. And again, loud sounds I've noticed is a big commonality with these kids. Just because they're able to hear, all their other senses are heightened to help compensate for this delay in the brain. So support is a big thing in this because there is no cure for this. Early intervention is huge in this, such as having speech therapy to work on their speech so they can communicate. Occupational therapy and behavioral therapy can make a really big difference too. These will give them coping skills to help with everyday life. Um, a big therapy that helps with a lot of these kids is something called cognitive behavioral therapy, or CBT. It's adapted for children, especially with autism, um, and those that have anxiety, depression, or emotional regulation issues. It teaches coping strategies, emotional awareness, and problem solving. So it really gets the child thinking about the situations and making them become more independent. Another therapy that helps is applied behavioral analysis, or ABA. This also is most widely used therapy for autism. It uses positivity reinforcement to teach new skills, which is huge. These children thrive on positivity and being over theatrical with these kids because they can't read emotions from other people very well. So you have to be overly animated in order for them to really understand. And they get so excited when you're excited. It's a highly structured and can be individualized for each child. It often delivered one-on-one by a trained professional technician or therapist. And usually your primary care physician will give you referrals to these specialists if there is a concern for autism diagnosis, or if there's any emotional regulation that needs help with. Creating a supportive environment includes visual supports. A lot of these kids need structure and they're very visual. So having that structure and that schedule, that visual, helps them see, okay, one task is done. Now I'm going to do this. And being there to help support them with that is a real great bonding experience because these kids will bond with you very deeply. This also, you know, means inclusion. Include the kids with other things. Um, Creativity, being with other kids that don't necessarily have autism. They will learn by observing these kids that don't have autism, that, certain behaviors and coping skills and strategies and socialization. That's really what these kids need and that they thrive on. So, autism is a very complex but deeply humanly experienced. Autistic children may see and experience the world differently, but with understanding, support, and inclusion, they can thrive. They're like a puzzle piece. They just need a few more puzzle pieces to make the full picture. That's all that they need. And they can function like everyday human beings without autism. They just need those few extra steps. And the more we learn about autism, the more we can build a world that accepts and celebrates this neurodiversity. Thank you for joining me today, and I hope you learned a lot. All of this can be found at on the CDC website, um, and which is the Center for Disease Control and Prevention, Autism Speaks, and the National Institute of Mental Health. Have a wonderful day.